Dr. Nicholas Mercer with uImproved PT. Welcome to the Complete Guide to Hip Flexors, a video series where I break down each hip flexor muscle individually. In this video, I will cover the infamous Psoas Major. We'll start with the anatomy of the Psoas Major, including its function and attachments. Then we'll look at the problems this muscle can cause when it's dysfunctional, including pain and mobility restrictions. Finally, I'll show you the best methods to strengthen, stretch, and ultimately restore this muscle to its proper health and function. The Psoas Major, often just referred to as the psoas, is a critical muscle in the human body, vital for various functions such as hip flexion, lumbar spine stabilization, and even influencing posture and breathing. The Psoas Major originates from the lumbar vertebrae and inserts into the lesser trochanter of the femur. This positioning allows it to act as a strong hip flexor. It's one of the major muscles allowing you to bring your thigh up to your chest. But that isn't its only action. Remember that the Psoas Major starts at the lumbar spine, meaning it can help stabilize the spine, and is a crucial muscle in maintaining both a proper standing and seated posture. Not to mention its role in breathing, research shows that the Psoas Major is able to exert influence on respiratory function and the relationship between the diaphragm and the pelvis. Unfortunately, when the Psoas Major becomes dysfunctional, it can lead to some major problems. Due to its attachment in the lumbar spine, a psoas that's not flexible or strong enough can contribute to lower back pain, stiffness, and discomfort. In the hip, a dysfunctional psoas can affect mobility of the hip and the strength of hip flexion, leading to pain from an irritated hip joint and a limited range of motion in hip flexion, extension, or both. Actually, it can even limit other movements of the hip if it's excessively weak or inflexible. And since the Psoas Major influences posture and breathing as well, dysfunction in this muscle can result in poor postural habits, potentially affecting the alignment of the spine, the function of the hips, and the efficiency of breathing. Restoring the overall function, flexibility, and strength of the Psoas Major is crucial to treating many cases of back and hip pain. I'm going to walk you through a simple routine you can use to restore the health of your Psoas Major. So simply follow along with the next part of this video. Let's get started. So the first thing we want to do is actually restore proper breathing, proper deep breathing. So remember, the psoas does have an effect on breathing and the relationship between your diaphragm, which is the main muscle that allows you to inhale, and the pelvis. And so what we're going to do is just restore some breathing, okay? What you're going to do, just lie on your back. Bend your knees so that your lower back goes flat against the ground. And you're just going to put your hands on your belly. We're going to restore some diaphragmatic breathing. You may have done this in the past, but I want you to really focus on this. And we're just going to do 5 deep breaths. So hand over your belly button. You're going to inhale, let that belly rise. And then as you exhale, exhale all the air out of your mouth like you're blowing into a balloon. Keep getting all the air out, all the air out. And as you're pushing that last little bit of air out, you'll notice you want your belly button to pull down towards the floor and your lower back to press lightly into the floor. That's 1 breath. 4 more. The belly expand, keep the lower back flat. Okay. And then as you do these last 2, I want you to think about relaxing the muscles in your hips. So relax the muscles in your hips and let the abdomen do all the work. All right, awesome. So a couple things there. We wanted to restore the breathing, get nice deep breaths to help tell the psoas, hey, this is all right. This is how we're going to breathe. You don't have to overwork here. Okay, you don't have to take over. Diaphragm's going to do its job. And we got some abdominal stabilization. So you probably noticed that your abdomen got really tight. Your abs got really tight as the belly button pulled in on that exhale. And that tells us, hey, look, Psoas, you don't have to stabilize the spine. Like, you're not alone, right? You can just help with stabilizing the spine. Let the abdomen, let the abdominal muscles do the main part, and you just help out a little bit. So now I'm going to grab my foam pad and put it under my knee. We're just going to go into a standard hip flexor stretch. So you can let that back foot just kind of relax on the ground. And a few things we want to lock in first. The first is nice deep exhale. Pull that belly button in. Make sure your abdomen, right, these muscles are providing stabilization to your spine, so we can focus on the hip portion of the Psoas Major. So just get in this half kneeling position. And first thing you're going to do, you're not going to lean forward. You're not going to focus on anything too much. The only thing I want you to focus on is where are you feeling that stretch. For me, I'm feeling it right in the front, and that's where you should feel the stretch for the psoas. Maybe a little bit higher as well, but right in the front here is where you want to feel that. And just relax into this position. You're really comfortable here. And so this may take a minute or two. Deep breathing. Let that spine be stabilized by the abdomen. Give the psoas a little bit of a break. Right? And you can slowly start to get a little bit of squeezing in this glute here. All right. So the next thing, we're going to add one more thing to think about. Try to get the top of your head to the ceiling. So we're really going to open up this side without breaking from the spine. Okay, we're going to stay locked in. The knee is going down into the floor, and my head is going up towards the ceiling. And that's going to increase the stretch here in my hip. Again, after about a minute or two, you should be relatively comfortable in this position. And if you have trouble balancing here, bam, just do it next to a wall or a couch or something sturdy, because we really want to focus on getting that nice stretch, not on trying to keep our balance, because that may make the psoas activate to try to stabilize too, right? But from here, I have some pretty good stability, so I'm not worried about that. So now this is the part that's going to be a little challenging. Once you've eased into that stretch, you've been in there for about a minute or two, you're going to think about, first you're going to bring yourself forward just a little bit. You'll feel that increase the stretch a little bit. And now what you're going to do is think about pulling your right knee forward, right? So I'm thinking I'm pulling my knee forward. I don't move, right? But I do feel, I can feel the psoas start to work here, okay? But I want it to apply tension. I want it to apply force, and I want it to activate without letting it shorten like that. Okay, so this is an isometric in this lengthened position, and this will actually allow you to stretch that a little more, right? So if you get here, you feel that really, really strong stretch. I want you to, and this one I may have to brace just to keep my body from moving. I'm thinking about pulling my knee forward. I can feel that working right through the hip here, just for 5 seconds. And then I'm going to squeeze my glutes and try to push my hip forward a little more. You're not going to move forward like this, right? You just want to squeeze that glute and let the hip push forward enough to get an increase in the stretch right through that psoas. Okay? And I'm just going to do that a few times. Again, this is after holding that stretch for about a minute or two, getting really used to that position. So I'm going to try to pull the knee forward. 3, 4, 5, and then I'm going to squeeze the glute, let the psoas relax, and try to get a little bit more of a stretch to that psoas, and this is getting pretty intense. Again, keeping the lower abdominals engaged, spine towards the ceiling, knee into the ground, and now try to pull that knee forward. We'll do this will be the last one, so we'll just do 3, and then push through the butt. Relax the front of the hip. Okay. So what we've effectively done is we've allowed that psoas to stretch a little bit, but in order to keep that stretch, we have to tell the brain, hey, we can control this position, so feel free to move into and out of it as you please, because we can control it now, right? Maybe not now. Maybe it may take you a little while to get used to this, but that's one of the most effective ways to stretch the psoas major. So we're going to start to strengthen and control the active action of the psoas major. And so all you're really going to do, again, the first thing we want to do is get the stomach and the abdominal muscles to stabilize that spine for us, so we don't have the psoas having to work to overwork to stabilize the lumbar spine. It's still going to help stabilize it, but we want most of that stabilization coming from the abdominal muscles. And we're going to start out, again, it's going to seem really simple. You're just going to bring that knee up as high as you can, slowly bring it back down, okay? And so I want you to try out like 10 of these, right? And what you may notice is the higher your knee goes, the more you have to stabilize through your stomach. And if you have issues with balance, stand next to a wall, stand next to a door, right? And just get a feel for, okay, this is the movement that the psoas does. Now, if you find at a certain range you get pain through your psoas, that's okay. I want you to go right up to the range where you get pain and then back off, okay? Especially if you get pain or pinching through the front of the hip here, okay? So if I'm good, okay, that's a little painful, back off of that range, come back down, okay? So this is really more of learning where your healthy ranges are and what ranges we want to be able to use in the future, right? So for example, I'm going to say that right above 90 degrees is where I get pain. I don't, but for the sake of this demonstration, that's what we're going to say. Okay, so right above 90 degrees of flexion, I get pain kind of in the front of my hip here, or in my back, or wherever you typically get your pain. And what you're going to do is, so I get pain right there. I'm going to back off. Okay, I don't get pain there. I'm going to push down on that knee very lightly, right? Maybe 10% of my strength, right? Okay, that feels okay. I'm going to go to 20%. Okay, now 30. 40, 50, and I'm going to ramp up to 100%, and then I'm going to slowly let it come back down, okay? Now for this one, you're just going to do that like 5 times. So I'm pushing, I'm slowly increasing how much I'm pushing, and then I'm going to slowly come back down. 3 more times. Right there's where I get pain, so I'm going to back off. Give myself some resistance. Keeping my stomach tight. Slowly come back down. I just got 2 more. I told you it's simple. Doesn't mean it's going to be easy. You may even feel the opposite outside of the hip start to get tired from the glute med working to stabilize you here. And slowly back down, okay? So that's how we can start to teach the psoas how to activate in a healthy way without irritating pain. For the last exercise, we're really going to try to lock in the strength of these new positions that hopefully, as you're doing the first few exercises, you're slowly getting more range of motion. Now we want to lock in that range of motion. So let's say that I'm comfortable, we'll say again, I'm comfortable at 90 degrees of flexion. And over that, not really comfortable. I still get a little bit of pain. Also, I've lowered the camera angle so you can see my setup here. What we're going to do is I have set this up so that when I rest my foot here, my knee's about, or my hip is about a 90-degree angle. Okay, so all I'm going to do is lock in stomach. Okay, so that has the stabilization. I have some balance help here. And all I'm going to do is from here, I'm going to try to lift my foot off of that block just a little bit. For a lot of people, for a lot of you, this isn't necessarily going to be painful, but you're not going to be able to get your foot off the block. That's okay, right? That's completely fine. What we're looking for is that isometric contraction of the psoas major. So you're just going to rest that foot there. You're going to think about trying to lift it off. 5 seconds. And then I want you to think about pushing down into the block, and you'll start to feel glutes working here, right? Then after that, I want you to try to, after 5 seconds of pushing down, try to pull that foot up again. And then same thing, push down. What you can do over time is increase how many books or yoga blocks or whatever you're using so that you're comfortable at this level, gradually higher and higher and higher, right? So let's just do 5 just like that. And I'm going to kind of show you what you should be able to do in the future. So I just grabbed some boxes I saw in the corner. I would have liked to have a yoga block, but this is the only one I have at my house right now. This just goes to show you, whatever you have at your house, you could figure it out, right? So let's say I have over the weeks worked myself up to this angle of flexion. This is a comfortable range of hip flexion for me. Now we're gonna go through that sequence, okay? So I'm gonna try to pull my foot up. 1, 2, 3, 4, 5, and then I'm gonna push down. 1, 2, 3, 4, 5, up, 2, 3, 4, 5, down, 2, 3, 4, 5. I'm gonna use my hand because my hip is getting a little tired. Up, 2, 3, 4, 5. I still got stabilization in my stomach. Down, 3, 4, 5. 2 more sets. Up, down, and last time. Up and down. All right, and slowly come off of that. Whew, and I can feel right through here, really getting worked. Follow these tips and you will be on your way to restoring the health of your psoas major and living a pain-free life. Let us know about your pain journey in the comments and subscribe to see more videos in this hip flexor series. Thanks for watching.